Good evening, everyone. First of all, I would like to introduce you to Dr. Geza Fontos. He is one of the pioneers of transcatheter therapy in Europe as well as in the world. He has so many procedures to his credit that now he has been rated as a number one of one of the first few operator in the world. He has been proctored to various countries in Europe and in India. And now the trained doctors by Dr. Geza Fontos are doing this procedure and training others also. So, Dr. Geza Fontos, what do you think about this Sentient Summit going on in Chennai today? And what do you feel that how the meeting is going on, how the people are participating in this?
I have to participate at least 1 to 2 meetings each month. We have a lot of duties to go all around the world. But I feel that the Sentient meeting is a unique initiative in several ways. First of all, it's a local meeting, which I think is going to be very famous for the warm hospitality and the professionalism in sense of organizing the meeting. The environment is just perfect for having a meeting. And I think that the most unique feature of this conference is that it tends to be a really multidisciplinary meeting in the field. Usually we have meetings for interventional cardiologists, for cardiac surgeons, anesthetists, imaging people, and this meeting tries to integrate the teams, which is, in my opinion, the most important in the field of structural heart disease.
Yeah, great. Absolutely right. And you have been to India so many times, you have proctored at so many places in hospitals, and you have attended various meetings in India related to transcatheter therapy. What do you think this technology or this therapy is going to be in India? Because we in India are a little different from the European countries, and this is a vast country, and our disease profile is again different, and practices are again different than the European countries. So what do you think? What is the take? How this therapy is going to be here in India in future?
Just to go back to the beginning of your question, I'm really lucky enough to have the possibility to come to India several times. I started proctoring these procedures about 5 years ago, and since then I've come back at least 10 times a year. I think this technology has a great future in India. Basically, you have a huge number of population, and even inside of this population, the proportion of heart disease patient is, I guess, higher than in Europe, for example. So there is a huge unmet need for the structural heart patients. I also see that the development of cardiac surgery in India is just on the top of the world. You do procedures that nobody else in the world could do, but still there are patients who are not a good candidate for cardiac surgery, open heart surgery. So I think we have to go forward for this patient population.
So you have told me, say you move around the world maybe twice a month, sometimes, as well as you do so many procedures every week, every month, and go to so many places. What is the thing? What motivates you to do all this? What motivates you to teach others for this procedure?
Yeah, it's a very good question. We went doing procedures outside of the country several years back, but we have a point when everything has changed, when we started to do local trainings, we call it team approach trainings in our hospitals, and where we invite 10 to 15 attendants from all over the world, and seeing how enthusiastic those physicians are in learning the procedures who have no access to that is just amazing. And since then we decided to do also local fellowship programs in our hospital. So each year we have at least 2 fellows, and I have learned a lot during my Indian trips as well, because you and your colleagues had such a huge experience in other fields as well, like coronaries, like communication closures, and I'll always pick something up and take with myself home to improve our hospital.
So I think with your conversation, I got to know that there's a lot more to give, and you also take something out of Indian practice of cardiology. Thank you very much, Dr. Fontos, for sharing your experience and your views with us today in Chennai. Thanks a lot.
It was my pleasure. Thank you.